But obviously the next speaker needs no introduction. She was the author of our nurse to ratio bill in California that we fought for and we won. She's been the champion of nurses and patients for as long as she's been in this building. She is #1 with the registered nurses, school employees, Sheila Kuehl.
I like that, loving protesters. I just think that's great. But you know what? We're not just protesters today. We're advocates. We're advocates for the real deal. First of all, I've got to say thank you to all of you. There would not be any SB 840. There would not be any chance for single payer in California. There would not even be any attention paid to health care in California were it not for you. So please give yourself a hand. We're here today because we get that there is a real definition for universal health care. Universal health care doesn't mean some, it doesn't even mean most, it certainly doesn't mean some of the time. It does not mean you've got to buy it whether you can afford it or not. That is not universal health care. What the governor's offered us is mandatory substandard insurance. Nothing like universal health care. Universal health care means every California family. It means a benefits package that provides access to care when you need it for your life. But it also means health care that everybody can afford. And when it comes to health care, the truth is one size actually can fit all. If the size is big enough, a plan that fits every Californian very well. The plan that provides us all with all the health care we need, when we need it, affordable, SB 840. And the people who are saying, oh, well, we're never going to get this, they are just flat out wrong. We're going to get it because we must have it. We're going to get it because you're working for it and so am I. Right now, as you know, I mean, who can follow that story of this wonderful, beautiful couple? And you know, as nurses, you know, as public workers, how many stories like that there are. How many of our co-workers, how many of our patients, how many of our families, and the middle class, which everybody says, oh, well, you know, they'll always be fine. They're now the ones most losing their coverage because everybody else has already lost their coverage. The cost of health insurance for real people has increased 4 times as fast as wages just in the last 6 years. It's bankrupting the state, it's bankrupting the businesses, and it's sure as hell bankrupting us. And insurance companies have totally proven one thing to us. They cannot be counted on to contain healthcare spending in a patient-centered manner. Blue Cross is double-crossed. Blue Shield is no shield. They have so many gaps in coverage, so many ways in which they're going to deny you insurance, and there's the co-pays and the deductibles, the unaffordable premiums, and as you see, just getting kicked off. Why? Because you used it. That used to be a joke with car insurance, remember? You know, we'd have an accident, we wouldn't even report it, because the next thing that would happen is they'd drop you. Like you pay for 100 years, you have a fender bender, you're out. Okay, my car's important to me, but this is life. This is health. This is real people. For these people to be doing it is a crime. And you know, the governor says the government can't do anything right. Well, maybe in the horseshoe the government can't do anything right. But on the 3rd floor, we are doing it right. Who's going to force insurance companies to try to do the right thing? I'd rather get rid of them. So he wants government to force insurance companies to do the right thing when he doesn't even believe in government. He wants them to force them to spend 85% of all the billions of dollars we're paying to them on direct medical care, but they're going to have those bean counters tell you what direct medical care is. Only 840 does it. You know it's truly universal. You know it provides total choice. You know it stabilizes the cost of the system. You know it works, as John Garamendi said, Medicare for all Californians. Now, I know it's hot, and I know you are ready to go do whatever great actions you're going to do today and for the rest of this year. But I want to say one more thing to you. I don't frankly care if this governor vetoes the bill again. He is irrelevant to universal health care. Real advocates, and you are here today, real advocates know we only need 2 words in life. I'm back. And that's what we're going to do. It's 8:40 today, 8:40 tomorrow, and 8:40 until we get it. 8:40 now. 8:40 now. 8:40 now.